We have an ETA of approximately 10 minutes with a 5-year-old unstable multi-system trauma patient. I'm upgrading him to a priority 1 trauma.
Background is an ATV ejection with positive loss of consciousness of a few seconds with some confusion afterwards. On assessment, the patient is unstable with repetitive questioning. We have a pulse of 155, blood pressure 79/55. He's setting at 95 on high flow 2 with a respiratory rate of 30.
We have an IV established in the left AC. He is immobilized to a long spine board with a seat collar. I have a recommendation for an air ambulance, which I already did request from dispatch. Do you guys have any questions?
No further questions. Room 1, they went to the route.
Copy, room 1.
Okay, we're almost there.
Okay, so we have about 10 minutes to prepare for this multi-system trauma.
Great.
Start with some role assignments.
Okay.
Angela, are you okay being a recorder?
Got it. Yep.
Excellent. So as recorder, will you keep an eye on vitals for me? And if there are any significant changes, let me know.
Sure.
And also, as we go through the primary and secondary survey, if I forget anything, just redirect me.
Okay, we'll do.
Excellent. Sheila, are you okay doing medications and helping me with any airway procedures? So
Sure.
if we bag, have you help me with that?
Sure.
Are you able to get pharmacy to help?
I think they're here. I can go check it.
Okay, perfect. And Mandy, vascular access. I think we have one IV, but we'll probably want at least another. If we need an IO, that will be you and IV fluids.
Okay, no problem.
Okay.
Absolutely.
Hello.
Great. Hey, John.
We should probably put on some PPE.
Okay, so everybody gowns, goggles. John and Sheila, should we draw up some anticipated medications? Okay.
Thank you.
So,
20 kilograms?
yeah, that's what we heard. So Broslo Blue, 20 kilograms. So for RSI, let's do ketamine. So 2 milligrams per kilogram. So that's 40 milligrams. And succinylcholine, 2 milligrams per kilogram. For pain, let's go with fentanyl in 1 mic per kilo boluses. So that's 20 mics at a time. Sedation, or if there's a seizure, Midaz, 0.1 milligram per kilogram, or 2 milligrams. If we get into trouble with ICP, I guess we could do 3% saline or mannitol. Let's go with 3% since this is polytrauma, in case the blood pressure is low. 3% saline and 5 mils per kilo. And we'll give that over 20 minutes if we can. So that is 5 times 20 is 100 mils. And I hear that there may be an open fracture, so some Ansef for that.
Good.
Cefazolin, thank you. Do you know the dose on that?
500 milligrams? Or
Five-
30 milligrams per kilogram?
Okay. And just round to 500?
Yep.
Okay.
And then maybe something for nausea.
Okay. So on Dantatron if we need it. If we're going to give it IV, we can do 0.1. So 2 milligrams. All right, I think we're good. Let's go ahead and draw up at least the ketamine sucks and fentanyl. Yeah.
If we get fluid and blood.
Excellent. Yeah. So let's do normal saline for our boluses, and we'll do 20 mils per kilo at a time. So that's 400 mils. And can we get, Angela, can you get the blood bank to get us some O negative
Sure,
blood?
I'll get blood bank and lab a call.
Okay, so O negative, and we'll do 10 mil per kilo boluses if we get to that point. So that'll be 200 ml. All right.
40 milligrams.
Mandy, do you mind just double checking that suction is working, and I'll get the
Okay.
advanced airway stuff ready. And Angela,
Yes.
will you just double check for me on the Broslo Blue? I think it's going to be a 5.0 cuff tube.
That's correct.
Okay, and
Oxygen and section are working.
Yeah.
perfect. And then,
Yeah.
And a 10 French suction and a 2 straight or curved.
excellent. So I'd like a 2 straight blades. Perfect. Thank you very much. Okay, so there's a 2 stylet.
2 milligrams per mil. 40 milligrams.
All right.
Okay, Mom. You just wait till we get the gurney out, and then I'll help you out. Don't want you slipping and falling too.
Ready?
Okay? Yeah, we're ready. All right, you go ahead.
John, when ambulance arrives, we'll be completely silent. Here, report for 90 seconds, and then we'll get to work.
Okay.
Okay, perfect. Hi, are you Mom?
Yes, Lori.
Lori, I'm Dr. Meckler. I'm going to be taking care of your son. What's his name?
Charlie.
Charlie. Okay. So, Mom, we're going to just listen to what the ambulance crew has to say, and then we're going to do a head-to-toe exam. I'll keep you informed. I'd love to have you at the foot of the bed and staying with him the whole time, okay?
Come right here.
Okay.
Just come right here, and then we'll be transferring over here.
Perfect. All right.
All right, everybody. This is Charlie. He's 5 years old. The situation is it was an ATV rollover ejection and multi-system trauma. I'm elevated it to a priority 1.
Okay.
Background is he took the ATV out by himself, got out. We don't know how he got ejected. Mom found him unconscious on the ground. When we arrived, he was conscious and slightly confused with repetitive questioning.
Okay.
On assessment, I would say he's unstable. His last pulse was 155. Blood pressure is 79 over 55. O2 sats 95 the whole time, but we have had him on O2. Respiratory rate went from 36 to 30. Clear and equal bilateral lung sounds. I'm going to give him a Glasgow Coma scale of 14 because of the confused speech and repetitive questioning. Skin's pink, warm, and dry, and his pupils are pearl at 4 millimeters. BG is 86.
Great.
So he's had good pulses the whole time. He's had good CMS.
Okay.
Palpation of his abdomen. We have acute tenderness of left upper quadrant.
Okay.
Pelvis is stable, equal chest rise. And back was negative on exam, so we have the C collar on. Everything was good back there. He had no problem. He has a big abrasion and hematoma on the left front, and the bleeding is controlled. He also has an open tib fib.
Okay. Great. Let's get him transferred to our bed and on our monitors. Mom, does he...